A look now at how government has navigated the political terrain during this pandemic. I'm joined now also by research professor at the University of Johannesburg and political analyst, Professor Steven Friedman. Prof, good evening and thank you for your time. On one end, you're saying government wants us to believe they can use science to control us, lock us in, and keep us in our homes. But on the other hand, they are saying, well, this pandemic will do what this pandemic will do. So it's now in your hands. What's behind those contradictions?
Yeah, thanks, Thabo. Well, the one is a result of the other. You will remember that at the beginning of the process, when COVID hit our shores, government and its scientific advisors kept on telling us that the science said that we could not avoid a severe epidemic. And when the only reason they gave for saying this is that no country had avoided a severe epidemic, so why were we different? Now, this is clearly not true. There are a lot of countries which have avoided a severe epidemic, quite a few of which are on our own continent. So it simply wasn't correct to say that we couldn't avoid a severe epidemic. But if you start off at the beginning saying there's nothing we can do, well, you're going to do nothing. And we've had this incredible situation where as the infection levels have gone up and now as the number of people who are passing away have gone up, government says, well, you see, that's what we told you. That's what the scientists told us. It's all as bad as we made out at the beginning. But that assumes that there was nothing government could have done to stop what happened, and that is untrue. There's one major thing government could have done to stop the massive rise in infections that we have at the moment, and that is that the reason for locking down early was to get some time to put in place a really effective testing and tracing system so that when people were ill, they would test positive, you trace their contacts, and you'd make sure that anybody who had the virus is isolated. That's how all the countries that have done well have done it. We failed at that. That's not the citizens' fault. That's the government's fault. What the government is doing now, because it's always had this approach which says there's nothing we can do, is to double down on that, as the Americans say, and to say, well, because there's nothing at all that we can do, it's all up to you. If you stick by the rules, if you look after yourself, you'll be okay. And if you don't, you won't. Now, the problem with that, I mean, obviously, we all have a duty to protect ourselves. If we want to protect ourselves by, wearing masks, washing hands, keeping our distance, all of that is important. But what if you are a person, for example, and there are hundreds of thousands of South Africans who are in this position, who can only put food on the table for your family by getting into a taxi, where you have no control over how many people are there, over whether you're infected or not. How can you possibly say that such a person must look after themselves? If you live in a shack where it's impossible to socially distance, how can it be possibly said that you must look after yourself?
So, Prof, what you're saying is we can't expect people to do what otherwise they would be able to do for themselves under normal circumstances during this pandemic, and still, as a government, not supply for those needs that otherwise they would have been able to supply for themselves.
Yeah, it is. Look, it is, first of all, as I keep on saying, we are not looking at the massive rise in infections that we're looking at the moment primarily because people didn't behave themselves. We're looking at it because the testing didn't work and the tracing didn't work. And therefore, government must take responsibility for that. But the situation at the moment is that government has placed people in a situation in which the only way many people can put food on the table for their families is to put their lives at risk. And that is not something any government should do. Government should have put in place measures to make sure that that didn't happen. And the claim that they're following the science is simply not correct. They like to say they're following the science when the science says there's nothing they can do. When the science says very clearly, and their own top scientific advisor says that you do not lift restrictions when infections are going up, then they ignore the science.
Yeah. Did they consult, did they get the views of civil society when they are coming up with these regulations, or was it just a box-ticking exercise?
No, it wasn't even a box-ticking exercise, Thabo. They spoke to business because they think business is important. They listened to faith-based sections of the faith-based community at times to make sure initially that they didn't open places of worship. And for the rest, society was ignored. And, if you look at where the majority of South Africans live, in townships and shack settlements, if you look around the world, what should have been done in townships and shack settlements is what was done, for example, in the Indian state of Kerala, which is that you go out to people in those areas and you talk to them and you explain to them what has to be done and you form a partnership with them. And it is worked brilliantly in Kerala. Kerala has 31 million people in it. By the last time I looked a couple of days ago, they had about a few thousand cases and 24 people had passed away. And that was an opportunity missed because, if you don't work with people on the ground, then you can't expect people, particularly in the conditions which people in townships and shack settlements are forced to live.
But Prof, they will tell you that it's a very difficult situation they find themselves in. Anyone and anywhere in the world would have difficulty with perfectly balancing freedom and health, perfectly balancing lives and livelihood.
No, but you don't have to, Thabo. You don't have to balance it in that way if you get the basics right. What quite a lot of countries have done, including, as I say, some on this continent, is that they haven't had to take that decision. And the reason they haven't had to take that decision is that they've controlled the virus effectively enough to ensure that people can do both. People can protect themselves and they can earn a living. And we could have done the same if government A had got the testing right, and they had time to do that, and B, if government had treated most of the people who vote for this government, who are people in townships and shack settlements, as partners and allies, instead of as people who should be controlled. Remember that it's very important to point out a lot of the restrictions which people disliked during the hard lockdown period were there because government believed that people in the townships had to be controlled. And the minister said as much. Minister Dlamini Zuma, when she was asked, why are you banning tobacco? One of her reasons was people in townships share cigarettes. Minister Patel, why are you not allowing supermarkets to sell cooked food? Because then gogos will sell at cheese and yama on street corners and people will all get the virus. So immediately when you say things like that, you're saying that you don't trust the people who voted for you. You don't trust the majority of South Africans. And the only way you can stop them from doing themselves and others damage is by controlling them with 73,000 troops on the streets.
So can we rely all on the certainty of science? Gauteng province now talking about reverting back to harsher and stricter lockdown regulations because science tells us so.
Well, the reality is the politicians seem to listen to the science when they have to and not listen to the science when they don't have to. There's something very important that needs to be said about the science. People tend to talk about following the science because they remember what happened in this country with HIV. And it is important to remember what happened with HIV because there the government ignored the science and a lot of people died as a result. But the difference between COVID and HIV is that by the time HIV got to our shores, everybody in the science community agreed on what the science was. If you took for the following medication, you would be okay. There's no agreement in COVID between the scientists because it's a very new disease and they're learning things about it all along. But the science which the government says that it's listening to is not the only science available. Our scientists seem to think that there's nothing you can do to stop an epidemic. There's scientists in other countries who say there are lots of things you can do to stop an epidemic. So when you say you're following the science, basically what you're doing is you're choosing one science over another, and it happens to be conveniently the science which says that it's not government's fault, it's the people's fault.
Professor Steven Friedman, I appreciate your time. Thanks for joining us tonight.